Chris, are we good to get started?
Hello, Veronica.
Hi. You.
So good to see you.
Thanks for joining us.
You're welcome.
Chris,
I love SES.
Me too.
Thanks, Anne Marie. All right, well then let's have a session. Hi, my name's Matt Miller, and welcome to the Access session, Membership Value and Key Benefits Post-Pandemic. I've already said my name is Matt Miller. I'm the CEO of CLARB, also known as the Council of Landscape Architect Registration Boards. Before we get started, if we go to the next slide, just a few housekeeping items and a few reminders to share. Really, what this slide is showing is if we have any technical difficulties, please use the Need Help button at the bottom of the platform somewhere down there. So take a look at that. Would also like to thank Remo for sponsoring this session. I think some of us had the chance to experience during the lunchtime break their platform, which I found to be pretty cool and interactive. And hopefully some of you will get a chance to see that, I believe, in some of the networking events later as well. So we appreciate your support on this really important and timely topic. And I am really pleased and honored to be able to moderate this session with just 4 extraordinary people. I will be joined by them in a few seconds, and really would like them to ask them to introduce themselves as they join me on the virtual stage. So if we could just, Chad, just pull that slide down, and I'd ask each of our panelists to introduce themselves. So Catherine, if you wouldn't mind introducing yourself, I'd like to start there.
Great. Thank you so much, Matt, and welcome everybody. We're so thrilled that you could be here to talk with us about membership and where we are as society groups, especially in the science and STEM fields. My name is Catherine Ort-Mabry, and I'm currently the Chief Marketing and Communication Officer for the American Society for Microbiology. So I'm responsible for all the visibility, all the impact on marketing and promotion and branding, the voice of our organization, as well as membership, and being the chief customer advocate. We're all about the users, and we are making great strides even during the pandemic. And I'm so excited to share those things with you today. I think, Matt, you wanted us to talk about our membership trends. Is that right?
You beat me to the punch, Catherine. So one of the things I was going to ask each of you a little bit later, but we can do that now, I think is good. Tell us a little bit about, as you introduce yourselves, what were your membership trends before the pandemic, during the pandemic, and now that we're hopefully heading away from the pandemic? Catherine, what have you seen at the American Society for Microbiology?
So at ASM, we represent about 30,000 people in microbiology, and we run the gamut from academic researchers to the clinical folks doing testing in laboratories and hospitals and other public health environments. So we have a broad brush across the field. So we're hoping to represent the field in the aggregate. And we have seen, just like everyone, the interest in, especially in domestic membership, interest has waned in the last decade or so. And so about 2 or 3 years ago, we went after that, and we were able to stabilize to a point at that 30,000 level that we're confident that's where we are. We also want to grow, but the pandemic has definitely had an impact on us. We are seeing fewer people signing up. However, what I am seeing, and we can talk about this later, is thanks to a lot of our global initiatives that are going on right now, our global outreach program, which is designed to encourage people in resource-limited countries to join ASM, we've seen that membership go up dramatically.
Excellent. Thank you so much, Catherine. Our next panelist, Veronica Purvis. I know, Veronica, you've had a lot of experience over the last several years. When we were preparing for this, we said, maybe you could choose one of the great societies you've worked for, but I'd love to hear a little bit about some of that experience as you introduce yourself. And then, of course, the membership trends that you've seen as well.
Okay, thanks, Matt. And hi, everyone. Welcome. So I'm Veronica Purvis. I'm currently the Associate Executive Director at the Skin of Color Society, also known as SOX. Like Matt said, I've actually had the interesting experience of being at 3 organizations during this pandemic, which was unusual for me because the first of which I had just ended a 9-year tenure with. So I'll be pulling from different experiences when applicable, but I'll be focusing on SOX. I'm also the membership special interest group chair for SES. And Matt, if you'd like me to answer that question now about our membership trends. So SOX is it's a young organization, a young member organization, founded in 2004 by about a dozen dermatologists, board certified dermatologists. And our core membership is physicians, board certified dermatologists who are focused around the specialty area of skin of color dermatology, which just basically means patients who have more pigmented or melanin rich skin. You don't have to be a person of color to be a member, you just have to be interested in the specialty area. And so because we're a young organization, less than 20 years old, it was teeny weeny when they first started and still a small organization compared to some others that I've worked for. And so our membership thankfully has really continued to climb since inception, but drastically so in the last several years, actually. And so the membership has climbed about 60% a couple of years ago, then 50%, and then just in the last year from 20 to 21, so far it's climbed 20%. So we've seen an incline so far, just not as much as we have in some of the more recent years.
Great, thank you so much for that, Veronica. Our next panelist is Chad Rummel. One thing that I'll share about Chad that he and I share in common is that we're both former classroom teachers. So we were bonding over that before we got the session started. So Chad, you tell a little bit about your background and some of the membership trends you've seen at CEC.
Great, thank you, Matt, and welcome everyone. I've been with the Council for Exceptional Children since January of 2020. I started full-time on March 1st and sent my staff home a week later. So I've been a COVID CEO up to this point. The Council for Exceptional Children is the organization that advocates and works with teachers who support students with disabilities and/or gifts and talents. Our membership, we're about to turn 99 years old. Our membership peaked right after 1975 when Congress passed special education law and someone needed to provide training. So we've always been a very strong professional development organization. However, in the last 15 years, membership has waned, going from 90,000 members at one point to when I started, it was just over 19,000 members. So we dropped, I guess that's 71,000 members since early 2000s. And we could find all kinds of reasons to attribute to that. But we've still held our same main pillars of being standards organization, professional development, and advocacy. So nothing has really changed in our program. But as we found out during COVID, it's really changed possibly because of our approach. Since March 1 of 2020, we've grown our membership by almost 1,800 people now. So during the pandemic, we grew by about 10%. And continuing, we're still seeing steady retention, steady regrowth, using some of the strategies that we learned from playing around and experimenting during the free-for-all that was that initial COVID mania last March and April. So looking forward to talking more about that strategy. But again, we're seeing an upward projection at this point, and we're hoping that continues for us.
Thanks, Chad. That's it's really good to hear that you're seeing a leveling and a turnaround there. Our last panelist is Debbie Trueblood. Debbie, if you wouldn't mind introducing yourself. And I know you've had some recent association management experience as well, where you're from in Illinois there.
Excellent, thank you. I'm Debbie Trueblood. I am a senior consultant at Association Management Center. And until recently, about 2 months ago, I was the executive director for Illinois Park and Recreation Association, which I admit is a little bit less science-based than many of you all. But I have also been the executive director for a science-based association before. I think the perspective I'm bringing to the table today is of the smaller associations, maybe a state-based association. So we had about 3,000 members, conference of 4,000, budget of 3 million. So I believe that's sort of what sets my perspectives apart on this panel. In terms of our member trends, what we were seeing is that in the 5 years leading up to COVID, we had grown by about 20% in terms of number of members. Then we stabilized. Then when COVID happened in between middle of March and middle of summer of 2020, we had grown by 13%. And then between the end of 2020 and early 2021, membership was falling a little bit because our members were individuals and many of them had lost their jobs. But I will be telling you more about what we did, especially for our unemployed members as we go.
Excellent. Thanks so much, Debbie. And before we get into the questions, I'd like, Chris, if you wouldn't mind pulling down the slide. One of the things we'd like to do in this session is have everybody be able to see as many other people as possible. So if you feel comfortable coming off camera, that would be great. Feel free, please, to throw any questions that you might have into the chat as we see them. And if they fit in, we'll try to address them or even ask you to ask them out loud. So we'll do our best to make this as engaging a session as possible. To start, you heard a little bit about the trends that our four panelists have experienced over the last several years. And so we have a poll that would just like to put up, Chris, if you wouldn't mind doing that, to ask you about your own trends. And so what happened to your organization's membership as a result of the pandemic? And this is, where is it just in general? Did it grow? Did it remain the same? Did it shrink? Or are you just unsure? So we'll give you a little time to go ahead and answer that and hit submit, and we'll wait and see what the results are. Chris, how are we doing on those results?
So we have about 76% participating. It's still going up a little bit.
All right. Give it a few more seconds.
Okay, we'll close it in 5, 4, 3, 2, 1.
You should work for Mission Control, Chad. All right, so you can see that it's a little bit all over the place, but there's a lot of shrinking taking place as a result of the pandemic. I think a lot of us can probably within our own organizations pinpoint what that might be about. And some grew, and we're going to hear a little bit about a couple of organizations, I believe, that did grow during the pandemic based on some of the strategies they implemented. And in a lot were able to kind of maintain their membership through very innovative ways. So we're going to go ahead and jump into the first question for our panelists. And I think for all of us, at least for my organization, COVID really forced us to think and behave differently. The answer to why do we do it this way, and the answer being because we've always done it that way, it no longer had any merit. We were able to kind of throw that answer out. And so, Chad, you really shared with us some different thinking about how CEC approached that question and addressed some of the membership challenges that you had. Can you share a little bit about how you behaved and thought differently during the pandemic?
Sure, happy to share with that. When the pandemic hit, we're all educators. When the pandemic hit, every single member's life was affected. They were no longer allowed to go to school, but they had to keep doing their jobs. And so everyone was in this whirlwind of we need help and support. And I recall we had an emergency call with our board officers, and we walked out of that saying, we don't know what to do, but this is not about CEC. This is about what can we do for the field. Money wasn't an issue. Well, it is an issue. We weren't concerned about it for the next couple of months. We thought COVID was going to be temporary. Let's just get through this and do what we can do for the field. So the first thing we recognized was we had a lot of resources that people needed. We had scientific journal articles on teaching online that were behind firewalls, all kinds of trainings that were recordings behind firewalls. So the first thing we did was we just opened everything up. We said, come have at it, take what you want. We were pushing it out. Our content was going viral. It was crazy because it was free. The only thing we asked was that you became a member for free first. You just come through our system, tell us who you are. It's free for the next, I think we said 90 days. It's free, just tell us who you are. Obviously, you can see where this is going. We're trying to build a cold call list or a really hot list of potential members. So at the end of the school year, we're still in the COVID mindset, but we knew we couldn't continue to offer free membership. We had to recoup some funds. So we started asking these people to stick around and renew and begin to pay dues. And we got an abysmal response. I mean, I'm just too embarrassed to even tell you how low the response was. So we stepped back and we said, wait a minute, this is the same renewal approach we use all the time. Why isn't it working now? And we realized we had a whole bunch of people that weren't our typical users in with us. So we said, we need to figure out who they are. So we developed an elaborate renewal survey that said basically, are you ready to renew? Step one, are you ready to renew? If they said yes, they got an invoice that afternoon. If they said not quite, it went down this rabbit hole path of what did you come here looking for? What did you find? What are you still looking for? And at the end, if they indicated they were maybe going to renew at some point or join at some point, we offered them a discount. But we took all of that data and then we began a catered campaign to them saying, guess what? We're going to extend you for 30 more days because we know you're looking for X, Y, Z. You just told us this. Here's all of that. We began this elaborate campaign, and all of a sudden we started getting a lot of people renewing. We were very, very happy. We had 26,000 new members join during that whole period. So we had 26,000 data points of what members were actually looking for in CEC. So that was our first tactic. And the second thing we did was we just put all of our PD and training on steroids. The kind of thing we would do once or twice a month, we were doing every other day. And we stopped charging for it. And we didn't make it free just to members. We literally put it out there for the whole world. One webinar we did it was viewed 96,000 times in 1 week. It's been viewed 140,000 times since then. Again, you didn't get a view for free. You had to at least give us your name. So we started building these humongous potential member lists, realizing we had not even come anywhere near saturating the market. There was a whole bunch of people out there that needed to join us. So we, again, started that whole process of figuring out why did they come here and how do we reach them to renewal. If we think about the membership cycle being recruiting and ending with renewal, we can't lose track of the data. And this is what the big takeaway for us was. We can't lose track of the reason you came to CEC. We have to use that reason because it's not everything, right? We all have these big proposition values and these long benefit and feature lists, but people don't come here usually for that entire package, especially if they're more seasoned in their career. They don't come here for every single thing you have to offer. They came for something. So we need to use that something to onboard them, to engage them, and to ensure we're renewing them using that one thing. So the big takeaway from us was, we can get people in the door for a specific reason. We can renew them for that specific reason. Our problem has been, and I think this is what's the big change for us, is we assume everybody wants everything and everybody's staying for everything. And that's not it. When you're a bigger organization or even a small organization offering a lot of things, you have to figure out what people really want from you. They'll come for something, they'll stay for everything else, but that come for something is the trigger that we're really focusing on right now. And later we'll talk about how we use that to acquire new members, but for us, it's been that onboarding, engaging, renewal piece, using what we learned during the joining that's helping us grow at this point.
Yeah, that's great. I think when we were preparing for this, it hit me that, you know, often, not always, association membership approach is here's what you get, as opposed to what you've just done is what do you need? And you found the answer to some of those things. Instead of packaging it up and say, here's what you get, join, you've went a lot deeper. And I think that's commendable. And I think we're going to see what Veronica has to say about how some of the organizations she's worked for, at least most recently, have behaved and thought differently during this about membership.
Yeah, I thought that Chad's points were really on point, especially the whole point of basically finding what your unique value proposition is and really focusing on that UVP and communicating that. But it really takes trying to understand and listening to what your UVP is in terms of your membership, what they think it is, not what you think it is necessarily. So what we did, our approach was basically to expand our outreach. Like a lot of organizations, we thought broader than our regular members. So our approach changed in that we started to engage a wider community. We opened up our programming like a lot of other organizations to the wider community of physicians. And we offered our programming as well as our annual meeting free of charge. But one thing that we did, and I'll talk about later, was really focus on the content that the members needed at the time. And one thing that I saw at one of my organizations was at a superb engineering organization was really listening to the members, understanding what they were struggling with at the time. And at that point, and still is the Paycheck Protection Program, the PPP. And so the organization offered free, frequent webinars about the ins and outs of the PPP and how to be eligible for that, how to apply for it, And our members, I mean, they responded in droves. They were attending these webinars. They were writing to our CEO. Something like 80% of the member firms became eligible and qualified for the PPP. And I think a lot of that was due to the help that the organization provided. And so I bring that one up because I was there in the midst of the quarantine, right when the quarantine started. I was at that firm. And I think the key was really listening to the members and responding quickly. And if you could do that, then you were, firing on all cylinders. So that's just one thing that I'll share right now in terms of the approaches that my organizations have taken and just what I've seen in general, the organizations that have responded quickly.
Very topical information, that things that were current and were needed in the moment. I think it sounds like what you're able to identify in that. Catherine, how about ASM? How did ASM behave and act differently and think differently during the pandemic?
Thank you so much. I echo exactly what's been said with Chad and Veronica. And I'd add a different lens or an additional lens to this, because being the microbiology society and community, we were on the front lines, and we literally were on the front lines. But we were not healthcare care practitioners, but our clinical people were doing the tests, and they were raising the alarms that early on in February, saying the tests are not working. We need emergency authorization. We need ASM. And so again, we listened to what they were saying and took immediate action. And in our case, we said, okay, open the science up. We have 100 years of journal publications, and there's extensive knowledge about coronaviruses in general. What can be used from that to develop the treatments and the testing needed? I will note that a lot of the research done on HIV/AIDS led to some of the important findings in the early days about SARS-CoV-2. But point being, open up the science, listen to people, leverage the networks. We're very fortunate to have a clinical microbiology listserv community function. It's been active for about 25 years. And so you've got a nice, robust place where we could listen and hear. We also have recently beefed up our advocacy group. And so they were ready to take the experts and open the doors at the FDA and the CDC so that they could fulfill what they felt like was their duty to the country and to the world, that they had knowledge that was applicable and they could do something to help. So ASM became that vehicle. In the past, that might have been a little bit truncated. It might have had to go through too many committees. It might have had to have lots of blessing on it. But with the urgency of the situation, all the red tape, all the silos fell. And you asked it early on, what do you think is about different and what do you think will stick? I think that's going to stick. I think we have seen where associations can be nimble and can actually have tangible result and impact in the communities that we serve and also the broader society. It's what we always talk about aspiring to, but when you have something as devastating as a pandemic come to you, there's still a silver lining there, that you can get people to talk about for an association like the American Society for Microbiology. You get people to talk about the science, you get people paying attention to science, talking about the importance of basic research and why you need to make sure that these pipelines work. So we are absolutely determined to make sure that these doors stay open, that we continue partnerships with our colleagues on the Hill, our colleagues in the regulatory agencies, and of course with all the scientists, so that we can provide information that really does help solve big problems.
Thanks so much, Catherine. Debbie, how about you? How did some of your organizations behave and think differently?
Thanks, Matt. Again, I echo everything that's been said before me. When COVID happened, as CEO, my mantra was, we're going to be there for our members when they need us the most, when they can't afford to pay for our services. And I shared that with staff, with board and newsletters and magazines from every possible podium that I could, so that everyone was on the same page. And that really sort of authorized various different committees and parts of the association and staff to have a clear vision, to know what we're moving towards so they could make decisions quickly. And so I think that was critical. Second to that, one of the things that we did, which I think is similar to CHAD, but on a different scale, a smaller scale, we said one of the ways we can be there for our members right now is with education. So we are a staff of 8. We're not a large organization, but between the middle of March and the middle of September, we provided 95 educational events, many of which were free, some of which were open member and non-member as well. So that was one of the things that we did. A piece of this, though, that was very important for us during 2020 that hasn't been addressed is DEI, diversity, equity, and inclusion. And my association at the time, we had already been doing a lot of DEI specific education prior to 2020 for the prior 30 years. So this was not new to us. So we were sort of positioned structurally to be able to act fast. And so when George Floyd was murdered, what we said is one of the ways we can be there for our members right now is to help them implement ways to be better and do better in their organizations on this issue. And so we doubled down on DEI. We created a host of new programs anchored by safe zone conversations. So members could hire the association to facilitate safe zone conversations for their employees. We had multiple themes, multiple facilitation teams, all of these different things. And I just found out that this week that program received a national award. So I'm very excited about that. And I would say that was a key piece of the ways that we could be there for our members when they needed us the most.
Thanks, Debbie. And one of the things that struck me as all 4 of you were speaking just now, and even when we talked last week, was, it's almost this return to the kind of the founding of our associations, which was, why were we formed? It was to help our members solve problems that they were challenged in dealing with. And it was this hyper focus kind of swing back to that mentality. What are the problems our members are having? How do we help them solve them? I think that was something that I've seen really accelerate, at least for the organizations that I'm familiar with over the last 18 months or so. Veronica, we were talking last week too about, one of the things I think that happened in the association world too was that this realization, oh yeah, we're part of an industry and a profession too. And there's groups and companies that we can work with to help us help our members. And you gave some examples of that through partnerships. Tell us a little bit about how you formed either industry partnerships or partnerships with other organizations that help to respond to either the membership needs or accelerate the mission of the organizations.
Yes, well, SOX is in a fortunate position because we are niche, like I mentioned before. We're a small organization, just over 1,000 members, focused in this specialty area. When organizations and companies are looking for specific types of partnerships, especially around diversity, equity, and inclusion, they find us. And so we've had biotech and pharma companies reach out, like Johnson & Johnson and Orthoderm and Pfizer, and it's a great challenge to be able to work with all these different organizations with dozens of sponsors and partners interested in trying to co-program with us, trying to sponsor our existing programs and things like that. So one thing that we did, and like Debbie was talking about, this really jump-started, the first quarter, second quarter of 2020, when society at large and organizations everywhere, we're really relooking at institutional racism, and that includes around medicine. And so one important initiative that we did around that time and into this year is we partnered with the New England Journal of Medicine and Visual DX, which is a software company that helps physicians diagnose conditions using imagery, and Zoom as well. We partnered with them. And so we worked to produce this webinar series that talked about structural racism, racial bias, health disparities around medicine and patients of color. There were about a handful of these webinars, and we gathered clinical experts, advocates, healthcare professionals, And they talked about COVID-19 in terms of comorbidities and cutaneous manifestations, and health disparities around patients of color. And so these webinar series, it drew a much wider audience than we even expected worldwide. And we ended up getting about 4,000 to 8,000 members and non-members, but mainly non-members because we're a tiny member organization, to register and attend these different webinars. And so the only ask that we had at the time was, yes, give us your contact information so we can continue to grow our database, right? But we got such great reception from the community, from physicians and allied practitioners about the content and how, informative, insightful it was. And so they want to do more of these. So we're looking at ways to continue to partner and to program things like this in the future. And one important initiative that we're looking at for 2022 is a summit where, again, we can bring together even more partners, organizations, but people in the field around clinical trials and the lack of diversity included in clinical trials, and ensuring that people of color are actually included in these, in product development and clinical trials, especially when these products are going to be marketed to people of color post-production. So that's one of the huge initiatives that we're looking at for 2022. And I may drop the webinar series in the chat, but that was a huge thing for us that really exposed SOCS to a global audience.
And it sounds like you're going to be continuing to build on that partnership framework going forward, which is exciting. Catherine, how about AMS? Now you were in the middle of it. I mean, this is something you've already talked to, and lots of partnerships there. I'm assuming that you were able to leverage to help the membership.
Absolutely. No question about it. And it's the kind of thing where you're reminded continually that science is a collaborative sport, that you always have to have a lot of people working together. We have a vision of the lone scientist having his or her or their eureka moment in a laboratory. But the reality is there's a whole bunch of people working on all kinds of things at once. And there are two things that I'd highlight in the last year that we did at the American Society for Microbiology. One was to build a supply chain tool in partnership with the Supply Chain Management Association. We were seeing that our clinical microbiologists couldn't get basic materials. They couldn't get pipettes. They couldn't get reagents. They couldn't get all the core fundamental things that they needed to actually test people to see what was going on with the virus in the population. So one of the things that we noticed was that this was not being tracked by the federal government, that supply chains were being limited, and we were not getting good information. So our groups came together and said, let's build a tool. And we partnered with people because this is not our area of expertise by any means. So we said, who does know how? And we found the supply chain manufacturers folks, and they helped us build an online tool where we went out and asked the clinical microbiologist, what are you experiencing on the ground? What do you have? What do you not have? And we fed it into a tool that ultimately became an information point for visits and conversations with the regulatory authorities as well as legislative folk. And they found it very helpful. The other thing, yes, Matt?
No, I was just responding with just how impressed it was that to make that connection in community with the supply chain folks, as you put it, from the Association for Microbiology, was just a really cool connection there, and probably wouldn't have happened if that crisis were in place.
If it weren't a crisis, that would have been a decade-long conversation with maybe something happening in year 4. We know how that goes. But it's a real need. And so that energy becomes a catalyst for people to say, yeah, let's go do something. I'm here to do something, not just to be passive. And they really wanted to help, and they wanted us to help them. And I'll come back to this later perhaps, but this was a great example of what we're working on a lot. And that is the integrated partnership, not only within the society, but between the different kinds of experts we have. There is a certain level of expertise within our scientific community. And I would never begin to tell someone how to do their research. but I have great expertise in getting the word out, in shaping messaging, in connecting with people, in building systems, in running associations, all of that. So the partnership between our staff experts and our scientific experts is a critical piece of why this worked and why we were able to do so much so fast. I think the days of associations sitting back and saying, I'll keep the records and maybe we'll do a conference, way gone, if they ever really existed. But now I think it's really important with the big problems that we have that we can be part of the solutions for, to leverage different kinds of intelligence, different kinds of people, making sure all voices are heard, and recognizing that it's going to take all of us, without the barriers, without the preconceived notions, to really have an impact in the world. And the other thing that I would bring to your attention for the answer to this question is that we launched a brand new worldwide meeting in 6 months. We, like everybody else, pretty much had an annual meeting, and it had to go virtual. It was not going to happen. So our CEO and the board and the executive committee came together and said, we need to do something different. We need something exciting and interesting. Microbes know no borders. Why should our annual meeting have any borders? So we collaborated with 8 other microbiology societies from around the world, and we had representation from every continent except Antarctica on the planning committee. We ended up having people come from 141 different countries. If you compare it to our annual meeting, we usually have about 20-ish, 24-ish% who will come to ASM Microbe, which is the annual meeting. And with World Microbe Forum, we had 42% of the participants of 7,000 people be outside the United States. So we were reaching all kinds of wonderful scientists all over the world. And we did that because we collaborated with other societies and healthcare organizations in situ. So it's a very exciting model. We have to look at the business end, and we have to look at the impact, and we're doing that analysis now.
Thank you so much, Catherine. I think one of the things that really stood out to me, what you just said, is you have a culture with your volunteers and your members that actually see your staff as SMEs in the association space. That recognition is so critical, to have the partnership between the staff and the membership and the volunteers, so that they can work jointly together and apply those areas of expertise for the betterment of the society. Debbie, I want to kind of get your thoughts on this. Before I do, I want to let Richard know I see the comment in the chat. I want to let you know, I think we have a question coming up that will answer that. If it doesn't, please ask it again. So Debbie, was the partnership model, some of the things we heard from Veronica and Catherine, true for what you experienced?
Absolutely. So certainly we leveraged every kind of partnership we could. Some of the ways that we did that, we had partners for education so that they could bring more expertise to our members. For example, we partnered with a risk management organization in our space so that people could learn more about how to mitigate some of their risks during early COVID. And for all of the DEI educational programs that we do, we intentionally invite several other associations to join us. They don't have to help us pay for the costs for the speakers. Their members get the same experience our members would get. So it was free and open for all of the different associations who would partner with us. And we would typically have 5 or 6 partner associations. I'm a strong believer that if those events are about changing hearts and minds, then we should be changing as many as we possibly can. Beyond that, I would say on the partner side, we had 2 brand new vendor partnerships that had just started January of 2020, where we just got so lucky that when COVID happened, man, we were in the right place at the right time. So one of those partnerships was with a group purchasing organization that helped our members sort of buy in bulk and save expenses. So when COVID struck, and here we had a resource for cleaning supplies and hand sanitizer and all of that at a discounted price, our members really appreciated that. And the other vendor partner we had, again, we were a park and recreation association, we had happened to just sign a contract with a vendor that gave our members discounts on a specific kind of outdoor fitness equipment. And you might recall everybody running outside as soon as those shutdowns started. So when that program, which had started as a small, tiny agreement, a one-year agreement, when we renewed that in 2021, it became the largest vendor partnership agreement in the association's history. I believe it will change everything for that association. So we were in the right place at the right time and just got lucky on that.
Well, you know what they say though, Debbie, no such thing as luck. It's when preparation meets opportunity. So I'm sure that there was a lot of preparation that made you make your own luck in that situation. Chad, how about you and CEC in terms of partnerships? What have you seen come out of that?
Sure, I'll share something considering the group we're with here today. Most of our group are in the applied sector. They're not doing a lot of research, although we do have researchers. But we use this as a chance, and we'd started a little bit before COVID, but we amped it up. We used it as a chance for us to work with funding organizations to get their research out there. You know, they're always hosting events saying, oh, come hear about the new research we funded, and no one shows up because they don't have the database that we have. And so we got them to do the webinar through us. Again, nobody's paying anything, all open, we're just sharing. They were so appreciative to have the chance to share their research to an applied group. And we used it as a chance to give our members free PD. And once again, we had then a hot list of potential members to pull in for that. And again, it was free. We get about 1,200 people, I believe, on each one of these we do. But from our side, it was something we weren't able to do well before. But we're able to actually partner with Mixer and do this in a way that benefits them as much as it benefits us. That's one of the areas we've seen partnerships changing our outlook. The other one I'll say as it relates to vendors in the last year is we discovered there'd always been a need to reach our members outside of our annual conference. We had not done a good job of providing those opportunities. I think most associations say, hey, come exhibit at our conference and we'll see you again in a year. And we've always been of that mindset. And this, because the conference blew up, it gave us a chance to think about how can we still connect those vendor partners with our members throughout the year. As a result, we created a partner solutions directory. We're now doing lunch and learns that our webinar that our partners are sponsoring. It's free PD. The sponsor is really just showing up, getting a 1-minute commercial. For us, it's one of those things that we should have done a long time ago, but until there wasn't a chance to engage with the partners in the same way at our conference as it had been, we knew our members needed it and we knew the partners needed it. So it kind of, this COVID forced us into a whole new realm of sponsorships. And I'll tell you, our partner solutions directory, it's bringing in about 50% of what our annual conference revenue was from sponsors. It's been that popular. We actually priced it far too low, not realizing what we could have gotten out of it. So I would say those are the two changes I've seen recently in terms of engaging with partners.
That's great, Chad. And the word you use there in referring to vendors as partners, I think that is critical. The way we always look big things in Clark, our vendors are not vendors, they are partners in helping us accomplish something. And at CES, we've got wonderful partners too that help us make this conference go. And looking at them in that way I think makes the relationship much stronger and has a better outcome. Something else that everyone's been talking a little bit about was acquisition and use of data, contact information in particular, in being able not only to help your membership, but increase and grow your membership. So Catherine, how has ASM used acquired contact information, other data to help the membership, but also potentially grow the membership? And you're on mute.
Here I am. There we go. Thank you. I think this may actually start to answer one of the questions in the chat. One of the things that was actually already on the docket, because we are exploring all kinds of ways to expand member engagement and member value, even much before the pandemic, but then it accelerated, right? We all realize that we've got to maintain that relevance. So what I wanted to also say here is that we launched last year the first ever salary survey, and we did this in partnership with Dynamic Benchmarking, and they've been fantastic to work with. They did an unpaid plug here for them, but they've done a great job. And what we expected just a minimal interest in this, and we thought we'd have to really fight to get people just constant reminders. But within just a couple months, we ended up with enough data to have statistic validity. And we ended up the year with, I believe, more than 1,000 participants, so that we had the right kind of distribution, we had the information, and we could actually have information that was helpful and useful to people. So the basic idea is that a member, it's a members only offering. They would come in, put in their salary, benefits, compensation package information, and it would be aggregated. Then a user, another member, can come in and say, oh, I'm looking for a position in Raleigh. What does a person of my age and stage and education and interest area make in that environment? And what can I expect from an offer if I do get this job? And it's incredibly popular. We've had tremendous uptake with it. And what it also does is it gives us a unique look at what the compensation trends are. So to tie this again back to inclusivity and diversity and equity, we are able to use that data to begin to look at trends in the field in the aggregated way, in the United States at least, to say, this is what we're seeing with people of color, with women, with all the different ways you can slice and dice the data. So over time, we're hoping this will be a very powerful tool, not only for the individual, but also for the society to inform our actions going forward.
Great. Thanks so much, Catherine. How about you, Debbie? Contact information, data, all of those things. How were those put to use for you?
Yeah, and I will be intentionally brief since I know we are now trying to get through quite a bit in our remaining time. For us, we knew that our members were individuals who were very much at risk of losing their jobs. So this was an industry that was decimated. And so organizations that we worked with were seeing things like 75% budget cuts. Many people lost their jobs. And so we as the association trying to be there for those individuals going through that job loss. And this gets to a little bit of what Richard is asking. We intentionally from the middle of March were intentionally seeking out personal contact information for our members. So to be preemptive, if you lose your job and the only way that we can contact you is your work email address, we're still here for you, whether you're employed or not. So give us your personal data so we can continue to serve. And we did get quite a few responses, but not enough. And so, I think what we were up against is people just did not believe that they could be at risk of losing their job at any level of their career path. They were at risk and they didn't necessarily want to see it that way. And so we did lose members that we then have to recruit back after that.
Thank you, Debbie. And Chad, you started off with a little bit about this and your approach in engaging your membership or what they needed. So how did you use that contact information and what you collected to help move things along?
Sure. I'll say that one of the things we did during COVID and been doing ever since is a lot of, again, put it out there, free stuff, just tell us who you are. And I'm going to share a tool in the chat box called Opt-in Monster. If you don't know about this, it's cheap, easy. You can add it to any website and it's super awesome. So one thing we do once a month in a certain section of our website is we work with one of our journal publishers to turn one of our articles open access. And we make it available on our website. Hey, free, click here, put it on social media. Using this Opt-in Monster content lock feature, they just have to give us their contact info and they get the article for free. So we've been doing that all over our website, all over our activity. Opt-in Monster has a lot of other acquisition tools that I'll pitch a couple of them. One that I absolutely love is if, let's say somebody is on your event registration page, they've looked around for X number of seconds, but they're not ready to register and they're about to click away, or they go up to the menu bar to click away. All of a sudden they get a pop-up when they hit the go away button, or they scroll up there, they get a pop-up. So what this is doing is it's allowing to not just collect information, but it's allowing to collect information in the middle of a stroke or middle of a hot activity. So if they were to scroll over a certain piece of your website, you could engage a pop-up on that particular place right there. So what we really focus on is not just getting data, not just getting names who attended a webinar, but on our actual website, what were they doing when they realized they may have an interest in us? And using that piece of information to further follow up with them. I think, again, we think about targeting a lot in membership, but we usually think about it when we're sending out messaging. But targeting and recruitment is so much more important. And then using that data in your database. So if we acquired somebody because they clicked on a journal article and wanted it for free and Opt-in Monster found them, we track that as we call an appeal in our database. So we know we got so-and-so from a scientific article, or we got so-and-so because they were scrolling on the convention page and didn't register. So at the time of acquisition, we're building out a profile for them before they're even our members. And I think that's been the biggest tool. And again, I'll share Opt-in Monster as one thing. It's like $10 a month, I think. It's super cheap. And we're getting amazing results from it.
Excellent. Thank you for that tip, Chad. That's an incredible solution there for what you're facing. Veronica, how about you?
Okay, so I'll keep this very brief and I'll just say something a little different than what people have touched on. I would say start with the end in mind with your data and try to ask for things that you think you will really use, not just collect for the sake of it. I do believe in staying prepared so that you don't have to get prepared. So I understand the desire to try to just collect as much information as you can, just so you have it in case you need it. But I would just caution with all of the data privacy that's becoming more and more important, and with GDPR, I would say maybe consult with legal. I know in my conversations with legal, they've cautioned against collecting certain information. So I would just say that start with the end in mind, think about what you actually will use, and maybe consult with legal. I would also.
I'm sorry, Veronica, just so everyone knows, and I'm going to assume that everyone understands what GDPR, could you just tell us briefly what GDPR is, and especially, how it applies to members in Europe?
Right. I was going to say it really just applies to, I don't even remember what it stands for anymore, but we've been talking about it for about 2 years now. If anyone remembers what it stands for, please put that in the chat. But it does apply to your members who are of the European Union in Europe, if they either live there or they're a citizen there, so they don't have to be physically there. And it basically, thank you, General Data Protection Regulation. Okay. And so it basically regulates the kind of information that you can collect on them. It's very serious. You can be fined. From what my organizations have found is that, most likely a lot of us probably would not be targets of GDPR persecution, but still, you still want to be careful. You still want to be mindful of it. We definitely revamped how we totally collected information, and we required opt-in, and we required the double opt-in, like I said, 2 years ago or so when this became active. It's been at least a year. I think it's been 2 years now.
It's been 2 years.
2 years, right? Anne-Marie, we were at the same organization when this all came down. And so it was a big deal. I mean, we focused on it for about a year, trying to figure out how to roll out to be GDPR compliant. So I would say, anyway, keep that in mind if you have European members. Of course, the CAN-SPAM laws are still an issue. But like I said, consult with legal when you're thinking about what you're going to collect, how you're going to use it. One thing that I had been pushing for organizations to collect, starting with the organization Anne-Marie and I were at together, was cell phone numbers. Like, that was just not a data point, a data field that we were collecting. And I wish that we had, because there were things that happened, there were crises that happened where we really could have used, push notifications via a cell phone, not just an app or email or whatever. So think about crises too, and how you're going to continue to communicate with your members down the road. Because we know, things happen. And so there were a lot of organizations who were scrambling to try to get that home address, so that they could continue to engage with their members in print in that way, or personal email addresses. But I would say plan ahead for the next emergency.
Yeah. Thank you. Great advice, Veronica. We have about 7 minutes left in the session. I do want to save a little bit of time for Q&A from anyone that's participating. Quick question for the panelists. answer 30 seconds or less. So this is the lightning round. Oftentimes of financial stress, membership from a consumer standpoint is one of the first things that gets jettisoned. That's not great for the member because now they don't have access to the benefits in the organization like they did. Did your organizations do anything to make membership more accessible for those that perhaps were financially challenged or any other situations? So lightning round on this one. If yes, what was it quickly? And if no, just no. So how about start with Debbie?
Excellent. Yes. We did very quickly 3 things. We partnered with our subsidiary foundation, and we said for our members who lost jobs that they could apply for a $500 personal disaster relief grant. And so ultimately the foundation gave to our members $33,000 to support people who had lost their jobs. And those folks at the same time were given free dues for the next year. And as we had a lot of student members, those who were graduating in 2020 and 2021, we knew they wouldn't be able to get up on their feet, become a professional, pay full dues. So their free student dues were extended by a year as well.
Excellent. Thank you, Debbie. How about you, Veronica?
Tried to keep ready for unmute, wasn't ready that time, sorry. We didn't have any membership hardship programs or anything like that. So I will say no to keep it short.
All right, thank you. Catherine.
We surfaced our existing programs. We've always had a hardship policy, and we've made sure it was front and center. So if anybody needed it, they knew how to get it.
Excellent. And Chad.
Yeah, we've had a program for many years. We've never decided what the term hardship means intentionally. For some people, it's they took an extended maternity leave and had a hardship. For some people, it's personal health issues. We've never defined what hardship is. Anybody can get a hardship once every 3 years and get their dues waived for a year. We don't ask questions, never have.
Well, thank you for that. So I'm going to pause here to see what kind of questions we might have from our participants. If you put them in the chat, that would be really helpful. If not, I have one more question for the panelists. So I'm going to give it a few seconds to see if we have any questions coming in from our participants. All right, I'm not seeing any, so I'm going to go to my back pocket kind of parting question for everybody. And so I found myself that through COVID, we've been able to find some silver linings in the pandemic and things that we were able to advance probably far more rapidly or engage our membership in more quickly. And it was one of those things that would not have happened if we had not had a crisis in front of us. So for each of you, what was your silver lining from the pandemic, from COVID? Chad, I'm going to start with you.
Well, because I'm Chad, I have to share two. Number one, I would say we are a very large organization with lots of divisions, chapters, components, state chapters, etc. And what we realized was we had to rely on each other during this. We had been for many years kind of drifting apart, doing our own things. The real key takeaways of things that succeeded for us for when more than one of those pieces came together and worked together. So our motto for a year as an ecosystem is stronger together. Last year it was we're all in this together. This year it's stronger together. That was really the case. The second takeaway is about flipping the switch between wants and needs, or between what we're offering and what you need. For many, many years, 99 years, we've been great at here's what we have. We know you want it, come get it. And we realize we need to, like you said earlier, Matt, we need to be asking the question, what do you actually want from us? You have to reinvent yourself, especially as the field reinvents itself. And when our entire community had to reinvent itself almost overnight, we realized we needed to do that more often. We don't need a pandemic every couple of years.
Yeah.
But we need a complete reflip every couple of years. And I think, that can only do us good moving forward.
Excellent. Veronica, silver lining.
I think that it really provided an opportunity, forced organizations and members to come together in a different way, in a more intimate, authentic kind of way, to rely on each other, to be there for each other and to listen. And I'm just really hoping that is what will continue, is that organizations, associations, we stay member centric and focused on our members and listening to them, and continuing to look for innovative, novel ways to partner and collaborate.
Excellent. Catherine, your silver lining.
My silver lining is shining so bright, I can barely contain myself on this one because it is such, again, I would never wish a pandemic on anyone, period. It's just real. But a crisis clarifies. And for the American Society of Microbiology, it really was that opportunity to be a partnership of equals, to hear all kinds of voices from around the world coming together to really have that positive impact so that we could get people testing and vaccines and pathways forward for getting through this. And also a chance really to talk about science. Because if you remember back to a couple, 3-4 years ago, you really couldn't get attention for science. But now people at just a cocktail party will be talking about curves and mRNA and testing and all kinds of things. And so people are interested and people want to know. So associations in the STEM fields have a real opportunity to leverage the energy and the time right now to elevate what we do and to show how we're relevant and how science is such an important part of society.
And quickly, Debbie, how about you?
Very quickly. We built member loyalty. During early COVID, we had a 13% increase in the number of members we had. People joined to be a part of what we were doing. Because of the disaster relief grants that we were doing, it caused the reputation of our foundation to drastically increase. We had the highest donation year of all time. And I think because of our DEI efforts, people saw that this is who we are. This is what we value. This is important to us. And I think that was deeply important. And again, we got lucky in a lot of different ways category. By early 2021 in our industry, the jobs were coming back, and all these jobs that people had lost were now being advertised, and they advertised them all on our job board. And the job board was expected to have the best year ever and moved way up the list to become the -- 2 revenue source for the association.
Excellent. Well, thanks so much to the panelists for sharing all of that experience and knowledge. I think